Hello. I'm the orthopedic registrar. Are you the anesthetic registrar?
Sadly, yes. What do you want?
There is a fracture. I must fix it.
I have heard this before. You know the rules.
There is a fracture. I must fix it. It is in the neck of the femur.
Tell me more.
It is in the right femur.
Tell me more.
The femur is in a lady. She is 92 years old. She fell over. She is in this hospital. She is in a bed.
Does she have any medical problems I need to be aware of?
Did you not hear me? She has a fracture. I must fix it.
Does she have heart disease?
Of course. She is 92. She will have ischemic heart disease and valvular heart disease.
Have you done an echocardiogram and a troponin level?
No. She will not be given a new valve and a bypass graft. Her risk of a new cardiac event will remain unaltered for the next 6 weeks. She will die if I do not fix her fracture.
Does she have any respiratory disease?
Of course. She is 92. She has smoked since she was 12. She has a chest infection.
Have you done pulmonary function tests and sent a sputum culture?
No. She will nor get a lung transplant. Her infection will get worse if she lies in bed for 5 days. She will die if I do not fix her fracture.
Does she have renal disease?
Of course. She is 92.
Have you sent bloods for renal profile?
No. She will not get a kidney transplant. She will die if I do not fix her fracture.
What if she has hyponatremia?
She has survived with it to the age of 92, and we don't have 2 weeks to spare to correct it. She will die if I do not fix her fracture.
Is your patient nutritionally compromised?
Of course. She is 92 and lives alone.
Have you improved her nutrition since admission?
No. You insist that I must starve my patients despite having no evidence to support this practice.
Does your patient have impaired cognitive function?
Of course. She is 92. She has multi-infarct dementia and Alzheimer's.
Have you done serial mini-mental test scores?
No. She will not be given a carotid endarterectomy, and I'm too busy to discover a cure for Alzheimer's this week.
Is your patient on clopidogrel?
Of course. She is 92. She has heart disease.
She is at risk of hematoma if I do a spinal. We should stop it and wait for a week.
No. She is at risk of dying if I do not fix her fracture. You can give her a general anesthetic. Bleeding is a surgical problem. I will deal with it.
I think your patient is high risk. I should not anesthetize them.
I agree. I will contact a competent anesthetist who is not afraid of a challenging case. I understand that you will take longer to give a spinal anesthetic than it will for me to fix the fracture. And that it will not work, and after an hour you will give her a general anesthetic anyway. You could always apply for a career at McDonald's.
What do you mean by competent?
One who is my friend and colleague. One who can complete fiendish Sudoku in the blink of an eye while drinking double espresso. One who can do a spinal in less than 5 minutes and wield white stuff and oxygen with skill. And operate my iPod. And one who understands that, if I do not fix this fracture, the patient will die a slow lingering death in pain. Oh yes, and drink beer with me afterwards.
Would you like fries with it?